Good afternoon. And today we have a pleasure of interviewing Dr.Ben Miraglia. Good afternoon, doctor.
Oh, good afternoon. Thank you for having me.
And for our audience, thank you very much for listening. If you have trouble sleeping or sleep next to the snoring partner, please click the right or share button. Or if you're a medical professional and just like us, you are very passionate to find roots and routes to reason of obstructive sleep apnea, I think this interview would be for you. And I really appreciate us being a community, and because only together we can find all pieces of puzzle of that disease of evolution, obstructive sleep apnea. And today we're gonna talk about how this disease affecting a future generation and what to do about that, and how medical professionals or dental professionals can help the children avoid that unfortunate sleepless night or not sleeping and breathing in the same time. And I want to introduce our guest today. So Dr. Miraglia has been my inspiration for a long time. I listened to his lecture on one of the seminars, Viva seminar, and he talked about growth and development and how terrible it is to extract the teeth for any reason. And we're going to talk more about that. But that inspired me, and we create the thinking process. And then also I had another guest, Dr. Gaudio, who brought a wonderful book, and we're going to show you slides from that book. And Dr. Miraglia was an inspiration. And I thought, okay, now that's the time to bring him on my channel. So I'm going to give you the short bio. Dr. Miraglia, he's a general dentist, just like me, and he studied orthodontics, just like me, in USDI, United States Dental Institute, and he was a teacher there when I was there, actually. And then he was very strongly involved into expensive orthodontics, means create the bigger jaws and bigger airway for kids. And he's been teaching that art and science, I would put it, for many years. And now he's a clinical officer of the education company Airway Health Solution. Airway Health Solution offering the courses as well as helping dental team to be trained to be able to provide that service as a team. And he's 31 years in private practice, and he's VP of clinical education for clear aligner company called Candid Pro. And he's on a board of the director of American Academy Physiological Medicine and Dentistry. We actually interview a lot of people from that organization. I'm very passionate about the mission of that organization. So my first question, we want to know routes to roots. My first question to you would be, what inspired you to become, to bring expensive orthodontics into your practice, or in general, to have that philosophy of treating airway and making airway bigger and all of that?
Yes. And so it didn't begin as an airway story, but going back, I'm 31 years in dentistry, but about 20 years ago, I started to head into the expansive orthodontic world. And so I took courses with the USDI, like you mentioned. I was learning about expansive orthodontics, and really my drive to do that was I was very unhappy with extraction orthodontic technique. So for the first 10 years of my practice, I was fixing teeth and doing crown and bridge work, treating adults. But I was seeing the kids who were having their teeth extracted in the braces, and it didn't look good. I didn't like what I saw. So in trying to see if there were different ways or other ways, I found expansive orthodontic techniques and early orthodontic techniques to avoid extracting teeth. So I trained with the USDI. I became an instructor for them after that. And then gradually, 20 years ago, starting to treat children with early treatment, anywhere from the age of 3 on up. If you treat them earlier, basically the approach isn't tooth focused, it's foundation focused. So we learn how to use expanders, we learn how to use guides. We basically learn how to get involved early to help get your breathing and musculature back, grow the jaws so the teeth can fit. So what began as an expansive orthodontic pursuit to learn how to grow jaws turned into, over time, recognizing that, hey, these children, some of their symptoms are fading away. Some kids would stop bedwetting. Some would stop having nightmares. Some would sleep through the night where they were waking every night. Some kids were basically having less trouble with their tonsils and adenoids. They were shrinking over time. Well, all these little pieces, one by one, added up. About 10 years into this, which would be 10 years ago, I started to teach it because we recognized that growing the jaws earlier, it not only helps you fit all the teeth in, but it also makes a better breather. And if you have bigger jaws, you have better breathing, you have better sleeping, you have a healthier child. So slowly the pieces were put together over about a decade. And now the last 10 years, I've been teaching it to other places so they could learn how to help children earlier.
No, that's such a wonderful journey. And of course, I'm very passionate about your journey, and I'm creating similar journey for myself. But my question to you, and it's mostly for general audience, tell us why extracting teeth for kids of any age is not a good idea.
Yeah, so I'm very against extracting teeth, both the baby teeth and the permanent teeth. And so the tooth extraction technique happens to be a tooth-focused approach rather than a foundation-focused approach. So when you look in the mouth, there's a perspective. And some people see very crowded teeth. I understand that because it looks really bad. But the teeth aren't the problem or the cause. Really what's happening is the foundation or the jaws are too small. So if you think about, the teeth, we'd like to keep them all. But if they're not going to fit, it's not because you have too many teeth. It's really because the foundation is too small. So then the obvious next step would be, well, how do we grow the foundation bigger? Well, let's grow the foundation to keep all the teeth. Now, when your teeth are too crowded and they don't fit, when you start taking out teeth, what you're doing is you're committing to keeping the foundation small. But when the foundation is small, you end up with less teeth. When you have less teeth, you have less tongue space. When the foundation is too small, you can't breathe well through your nose. And then, of course, the compensation or the after problem that you have when you can't breathe through your nose is you breathe through your mouth. And there's a big difference between the two. So in order to have a really healthy child, we do start by saying we want to keep all the teeth, but we can't just move them to where they belong. We have to actually grow the foundation first. So the sequence of events is grow the foundation first, then line up the teeth and they fit. And so I'm not a fan of extracting teeth. I would tell parents that if someone suggests extracting the baby teeth, that's not a good idea, because what happens when the baby teeth come out, they line up the permanent teeth. But now you've lined up the permanent teeth and the permanent teeth look better, but there's no space for the next permanent tooth to come in. So it's kind of like kicking the can down the road. You just push the problem to the next year or the next year. Not very good idea. So I don't like taking out baby teeth. And then when you get a little older, 11 or 12, I don't like taking out permanent teeth, because a human being that has full development is supposed to have 32 teeth. We're supposed to get the right size to have all 32, including the wisdom teeth. And basically a fully grown human being is the healthiest opportunity that we have, because when the jaws are fully grown, it holds all 32 teeth. But when the jaws are fully grown, we can be the best nasal breather. We really need to be breathing through our nose to be helpful. So I'm not a fan of extracting any teeth. My advice to parents would be, if someone suggests extracting teeth, I believe you need another opinion. And I think you need to get another opinion until you hear someone say, we don't want to extract any teeth. Let's grow the jaws enough to keep them all. That's what you're looking to hear. No child should have extractions of any teeth. That is always bad in my world.
No, I agree with you 100%. But I'm going to ask you about different solution of what parents can have to accomplish non-extraction life journey. So first of all, how early you think child should be diagnosed?
Yeah, so today it's really turning out that 3 could be late, but in my office we see 3 on up. So from age 3 they come in. I don't see 1 and 2-year-olds, but a 3-year-old has the baby teeth, and you can make your diagnosis right then and there, because we have a fancy word in dentistry. It's called malocclusion. It's just a big, long, fancy word. I apologize for that word, but it means bad bite. And bad bite means your teeth are not really where they belong. And so if you have a bad bite or teeth not where they belong, it is visible in the baby teeth when you're 3. Now, what parents would recognize in looking at their child is that there's no space between the baby teeth. That's a telltale sign there's going to be trouble later. In fact, the history of dentistry has a long, long line of research that shows when the baby teeth don't have spaces or gaps between them, the permanent teeth are going to be very crowded. But then there's also the bite. How do the teeth come together? And so when the teeth come together, a good bite means we can see the bottom teeth. but a bad bite, we can't see the bottom teeth. So there's a difference. Now, this bite, when we can see the bottom teeth, is appropriate, but most children at 3 years old already have a bite where they can't see the bottom teeth. So when you can't see the bottom teeth, it means you're closing too much like this. That means there's less room for the tongue. So the farther in the bite goes, we call it a deep bite, but the more you can't see the bottom teeth, the less room there is for the tongue inside. So when you have a 3-year-old that has no spaces in the teeth and a deeper bite, we can't see the bottom teeth. We already know that's what we call early malocclusion or an early bad bite. Now in dentistry, we know the research shows us that children don't spontaneously heal. There's no growing out of a bad bite. So if we have no space and a deep bite or bad bite, it's going to be the same or worse when they get into the mixture, the permanent teeth coming in and then the permanent teeth later. So if you know the problem isn't going away, it's better to treat it when you first see it because it's easier to treat it earlier. And because the teeth are together or tight, it really is the foundation that's too small, but then there's the breathing issue. So then the children aren't nose breathing day and night, they're mouth breathing, and there are symptoms that come with that. So basically we have unhealthy children because the jaws haven't grown well enough, and we see it in the teeth not being spread out and in a right bite. So we recognize at age 3 there's a problem. That's when we want to start. So basically we like to offer treatment when we diagnose an underdeveloped jaw structure, or fancy word malocclusion. And that it can be seen at age 3 already. Earlier the better.
Yeah, I just want to mention, I put a couple slides from the book. You are actually the inspiration I mentioned earlier about that book. And I find that book is so useful to have a conversation about early development. And I recommend all dental professionals who are watching us to get the copy of that book and maybe share with your patient pool and explain basically about the same thing Dr. Miraglia explained to us right now. But I would like to ask you about the, routes people can take. Not everybody can come to Mount Kisco, and some people have to find other solutions, and they have to know what's right, what's wrong. So I'm going to ask your opinion. What do you think about non-custom growth and development removable guidance appliance? Because a lot of parents want to start earlier. They understand because now social media plays a significant role, and a lot of thought leaders are on social media guiding the audience towards maybe non-expensive, non-extraction orthodontic, expensive orthodontic. So they're trying to understand what's right. And I want to know, what do you think about non-custom made growth and development guides?
Yes. And so I'm a big fan of those. So I began using them about 20 years ago for children between the ages of 3 and 12. And I find them to be very effective. And so they're usually not a standalone treatment. Usually what we're doing with those guides is instructing a child and parent to wear it for an hour or two in the evening plus overnight. But we also do a lot of nasal hygiene instruction, how to blow your nose, what type of nasal sprays you could use that are kind of natural or homeopathic to get your nose clean. And then getting nasal hygiene in the picture is very good. Using a guidance appliance can be very helpful. And then the third thing would be some exercises that a child can do as well. And the big fancy words for that are myofunctional therapy. So I am a big fan of the guidance appliances. Between 3 and 7, I really love them, because between 3 and 7, I prefer not to really use expanders too much in that age group. The kids are kind of little. And with the guides and exercises and nasal hygiene, you can do a whole lot for those children. So I'm a big fan of them, and I like them a lot. And as long as you incorporate other things, and then even a little further is sometimes you have to assess the frenum that are there. And that's a fancy word, but some people have heard of tongue tie. And so if you have a lip tie or a tongue tie, it can restrict your growth and development. So sometimes that has to be incorporated. So I would say a guide alone, it's better than nothing. But if you can incorporate a guidance appliance plus good nasal hygiene, plus some exercises, myofunctional therapy, plus a lip tie or tongue tie release when it's indicated, that's a really nice combination that can help a child. And I've seen it for 2 decades do wonderful things for children. So I'm a big fan of guidance appliances, maybe just not alone. With combining other things like this can really make a difference in a child. 8 to 12 years old, the guides are still effective in that age range, But I find that a lot of 8 to 12-year-olds do need some fixed expander techniques because they're really narrow and they're really crowded, but they also have severe symptoms because it's been a long time of bad breathing and sleeping. So there's a percentage of 8 to 12-year-olds I prefer to get into fixed expanders first. And then with the fixed expanders, get the foundation caught up and then take them out and switch back to the guides to keep going. Because basically a guidance appliance that most parents don't even know they exist when I first mention it, because they're like, what's this? Is this new? But they have been around a long time, but they're just not aware that it's a choice. But basically a guidance appliance, when a child wears it, it helps to redirect the breathing. It's like a trainer for breathing because you have to breathe through your nose. But it's also a habit corrector for the tongue. It's going to retrain the tongue to go to the roof of the mouth. So it helps the tongue do proper function by going up to swallow instead of back and forth or side to side. But it also pushes back on the lips. So it kind of puts a little barrier between the lips and teeth because we don't want our lips and cheeks squeezing on the teeth because that moves them in. And so we use those appliances to help redirect the breathing and the muscles. Because in the end, it was the poor breathing and the muscles that got us the crowded teeth and the smaller jaws. So we may as well try to treat the cause. So I'm a big fan of the guides for children.
That's such a great answer. And if you can give it to my audience the name, I am a big believer in the nose hygiene. What homeopathic solution you recommend to clean the nose for kids?
I like the Clear products, and Clear contains xylitol. That's a natural.
Yes.
So the Clear products are mostly natural, homeopathic, as we would describe them, and they don't contain any type of a steroid or a medicine, because we do want to be able to use them multiple times a day and for an extended time to help that child breathe through the nose. So I'm a fan of the more natural products, and Clear has been very kind. They actually have a kids version, a kids Clear product. It's at all the pharmacies, Amazon. You can get it anywhere. And I've had good success with that one. Yeah.
Fantastic. I'm going to ask you a very controversial question. What do you think about removable expanders for adults? We all learn with the surgical expansion, we can have a flat palate and more space for the tongue. But a lot of people are very conservative and they don't want to go for the surgical option. There are a lot of removable expanders for adults. It's been around for many, many years. What's your opinion? Because a lot of orthodontists are very skeptical and they hate that.
Sure. And I can understand that too, because they're a little technique sensitive. So what happens is an adult bone is more mature. So it's not as easy to move it around like the child is. So when you're talking about the adult and they have choices, not many adults want surgical options. And so I understand that. So I went and I tried to learn all of the options that we could offer, because for the adults who don't want surgical options but could use some help, can this help them? And so I learned about 15 years ago how to use removable expansion appliances for adults. And what I learned was a technique that is very slow and very gentle, and it is very methodical. And so there's a pattern of wearing the appliance as well as taking it out. And when you wear it and take it out in cycles, you're basically producing a cycle of pressure and tension. And bone does grow by cycling pressure and tension, not unlike the tori grow in the mouth, the bumps of bone on the inside or on the roof of the mouth. Those are growing by cycling pressure and tension. Well, if you can cycle pressure and tension appropriately, you can cause bone to grow. So the issues are that it does take just the right adult. So my opinion is they're good appliances, but it's not a match for everyone. So if I were to have a consultation with an adult and we talk about these as an option, I have to teach that adult that this is going to take 12 to 18 months, very slow. You're going to have to wear your appliance for 2 to 3 hours at a time, but then take it out for 1 hour or so, give your jaws a break, then put it back in for a couple hours, then take it out for an hour. So in and out over time. And then every 2 to 3 weeks, we make a slight adjustment, just a slight adjustment for an expansion. And if the patient can wear it perfectly and make the turns and have comfort, because it's not supposed to hurt, and it's not really supposed to tip the teeth either. It's supposed to cause bone growth from the cycles of pressure and tension. So my experience over 15 years has been the adult who can wear it appropriately can have success in bone growth without tipping the teeth. And then after that, we put them in aligners to just align the teeth a little bit better. So I have had a good experience with them. The percentage of adults using them is small because it is very few who can follow the wearing pattern because it's difficult to speak with them in. So when you combine all of this information, it's a small percentage of adults who can wear it during the day, 2 hours in, 1 hour out, and still be at work and talking on the phone or teaching a class. So it's difficult to talk with. So it's not a match for many adults. And I think that the problem with those also is a poor technique can cause trouble. And so if the adult isn't wearing it properly and still turning it, well, then the appliance is growing, but the bone isn't growing. That's when the teeth are tipping. That's when bad things can happen. So, it's like anything else in dentistry. If you have a great technique and a compliant patient, you can have success. But if the technique isn't so good and the compliance isn't so good, that can intersect at a bad outcome. And so I totally understand, where we're going with that, because there are cases where things went sideways and maybe didn't have the best result. And it's very unfortunate for all involved. But I have not had that experience. I am very limited in how I use those with my adults because I do have a full conversation about the dedication they have to do to wear it well. We monitor them closely. It is a very slow technique, but it's their only good option that is non-surgical. And the next level would be when then we consider jaw surgery, or we come away from that and we just talk about clear aligners and what is the difference a clear aligner can make, and any improvement you get. So my opinion is they are good. They're just technique sensitive. And I think they're a match for some people, but not others. So cautiously used, they can be a positive tool for an adult.
Wonderful. That's a great answer. And it still brings a hope. And now my last question to you, you and me so passionate about airway fitness and malocclusion and, how we can change a map of a healthcare. But still, myofunctional therapy, I want to know about your opinion about that. I highly believe in that, but it's not on the map. A lot of medical professionals are very skeptical. What's your vision? How to put us on a map of healthcare? What people who are passionate about it would not be scared to share their expertise and, fight for it. What language you think we should use to be visible?
Sure. Yes. And so I am a big believer in the myofunctional therapy. If we went back 20 years ago, I didn't know it existed. When I first started learning, I didn't know about myofunctional therapy, and I didn't really know the extent of the frenum, the tongue tie issues. Then over time, you start learning more and more. Now, 21 years later, I try to send all the patients to the myofunctional therapy community, especially the children. Now, it's beneficial at any age. And what the myofunctional therapy, it's long, fancy words, orofacial myofunctional therapy. But a way for a parent to think about it is it's like physical therapy for the head and neck. And so physical therapy we know about when you rehab your knee or you rehab your hip or your shoulder. But rehabbing the head and neck is different. It's called orofacial myofunctional therapy. Now, we got into our problem because the muscles are doing the wrong thing. So way back when we're little, we start using our muscles wrong. And all of a sudden, the muscles are weaker and they're dysfunctional. They're not functioning properly. And that creates the poor jaw growth and development and the crowded teeth. So the myofunctional therapy is to try to get back to the proper muscle balance and strength to help you grow better and kind of deliver the teeth where they belong through treating the cause. So it's really one of the most important things you can offer any human being, because you're actually treating the cause to get the tongue functioning properly, improves your breathing, to get your lips and cheeks out of the swallowing, and then, of course, to have better posture from it all. Because if you work through the musculature and the breathing, you can improve your posture, and everything downstream can be healed. So it is a pathway to treat the cause. I'm a big fan. I think we need more myofunctional therapists, because what I've learned over time, traveling and teaching around the country, you learn that they're not in every community or close. Some people say, the nearest myofunctional therapist, when I looked it up, is 2 hours away, 3 hours away. So we probably need more. And I believe that every single child should have myofunctional therapy earlier, because it does help address the root cause of this, the muscle dysfunction and weakness. So I'm a huge fan. It helps at any age. We make a lot of referrals to the myofunctional therapy community. And when I do teach doctors, you have to find the myofunctional therapy community and either refer to them or have your hygienist get trained, because you can have a hygienist be trained and offered in the office. And that helps for people where it's too far away. So I totally believe in it. Every child should have a part of it. And I think in the long run, if children had early myofunctional therapy, they would be much better off as they grew and developed. And then when you have less symptoms and you have a more healthy society to have myofunctional therapy early. So yeah, the vision for the future would be all children get early access and all children have myofunctional therapy at a young age possible, because then you can change the course of their future. Why should they be so unhealthy and on all these medications for the symptoms when you have a pathway to heal them with some myofunctional therapy as a component? Not that only. It's like everything else. We don't want to do one thing only. You want to combine it all. So collaboration. If we all collaborate together, then you have a pathway to heal a child, because it's not one thing only. It's a mixture of things going on, but all of it together earlier is really the answer. And I'm hoping that this kind of pathway will lead to a change in the focus, meaning dentistry has its history focused on the teeth. And I love the teeth. We all love the teeth. We need the teeth, and we have to fix the teeth. They need attention. However, I'd love to see the focus shift from the teeth to the foundation, to the growth and development. This way, dentistry could be more a healthcare providing entity than a tooth fixing providing entity. So if we focused on the growth of the jaws as well as the teeth, let's call it equal. If we focus on both, we're good. I don't want to make the teeth second best or last place, but focusing on both would be wonderful.
Thank you very much. It was so much knowledge. We really appreciate your vision, and I really hope what in the near future we're going to be on a real map of healthcare. So thank you very much to you, doctor, and we're looking forward to know more about your discoveries and pathway. Thank you.
It was my pleasure.